All right, so this is a dry needling technique that we can use for lateral epicondylitis, or more commonly called tennis elbow, often from overuse injuries, repetitive motions in the elbow. So all of the muscles that come along the back of our forearm, most of them attach up at the lateral epicondyle right up here, which we call this the extensor mass. So we can get into a lot of different muscles by going around this area. So we'll put a few needles around here. And this way we're getting a lot of different muscles with just a couple different needles. And this is typically the point that there is a lot of inflammation with this type of injury. So again, we're kind of getting the autonomic nervous system to take our body out of that fight or flight high chronic pain levels. So this can kind of work that system as well. And then we'll come down through the forearm a little bit, through the supinator muscle over here. And then we'll do a couple down through the base of the arm. And the main things that we're looking at here, we just don't want to get that ulnar nerve that's coming around the base of this bone here. And besides that, there's not too much to worry about. Sometimes this can be a little sensitive, but there aren't any areas that should be super, super uncomfortable. And then when we do this type of treatment in the arm, we would always be connecting some of these to the cervical spine. So we'll do some needles up there. We can also do this with electrical stim, just so we're kind of getting the nerves from the neck all the way through the arm, since they kind of will, all be a part of the pain that the patient's having.
Good.